Okay. Hello, everybody. Thank you for attending this collaborative postdoctoral fellowship program webinar. I'll be talking about this for the next 30 to 35 minutes, and then I'll take some questions at the end. So this is a HRB call. It is the Collaborative Postdoctoral Fellowship Programme. It replaces the ARP programme, and the aim is to build capacity in academic-based researchers to help them tackle applied health and social care challenges. So what we're going to cover today is, we are going to cover today are the objectives, the research scope, the funding model, the applicant team and the greater consortium, the eligibility, excuse me, the funding and duration. I'm going to talk a bit about the HRB fellows that are going to be recruited on this programme, and then I'll go through the application and review process. At the end, I'm going to go through the leadership team narrative CV because it's a new type of CV that we are trialling here in the HRB. Okay, so for the objectives, the first objective of the scheme is to build postdoctoral researcher capacity by supporting researchers to contribute to applied health and social care research and to really help them on a journey on a path towards independent investigator status. We want to build on existing investments at PhD level by providing postdoctoral opportunities at postdoctoral level so that these postdocs can also go on their journey with guidance of mentorship as well. The call wants to tackle an identified problem in the context of health, public health or social care from a research perspective in a collaborative and complementary approach. And we want the grants funded under this call to also foster partnerships within and between academic institutions and service delivery organisations with a view to making the outputs of the research usable and translatable into policy and practice. So the research scope of the CPFP call is applied health and social care. For the purposes of this scheme, applied health and social care research is defined as research with an emphasis on providing evidence that will impact healthcare, impact healthcare policy and practice and will lead to better health outcomes in Ireland and beyond. So this includes clinical research, health services research, and population health research. So under clinical research is just a little bit about each of these. Clinical research will be research with the goal of improving the diagnosis and treatment of disease and injury, with the goal of improving health and quality of life. So it really involves the direct participation of patients, healthy subjects, and their samples or their data. So then health services research is research with the goal of improving the effectiveness of health professionals and the healthcare system. And population health research is research with the goal of improving the health of the population through better understanding of the ways in which social, cultural, environmental, occupational and economic factors can determine health status. There are a number of items that are outside of the research scope for this scheme. So ultimately, the scheme will not fund research grants that come in that are based in basic biomedical research. It won't fund research involving cell lines or animals or their tissue. It's too early in the research process for those. It won't fund any preclinical studies, so no evaluation of potential therapeutic interventions in cell lines or animals. It won't fund any applications seeking to evaluate a clinical trial or another type of intervention. Now this, because trials are supported by the HRB ILCT, that's the Investigator-Led Clinical Trials Programme. It won't support applications which are literature reviews or systematic reviews, audits or surveys or needs assessments or technology developments. They can be elements, but they can't be the whole research study. It won't fund applications which are solely or predominantly developing infrastructure such as biobanking or databases or patient registers, particularly when these don't have a predominant research element. It's important that grants have a research focus. It won't fund research intended to create human embryos for the purposes of research and stem cell procurement. It won't fund any applications from individuals who are associated with the tobacco industry or anybody who is associated with the alcohol industry or related actors. So the funding model then is a little different to your standard sort of grant application. What we're looking at here is an applicant team model. So although this is a program which focuses on looking at the building capacity for postdoctoral researchers, these calls or these grants will be led by a lead applicant and two co-lead applicants, 1 to 2 co-lead applicants. So the lead applicant will be the person who is in the host institution for which the grant will be submitted. And the lead applicant is the person with primary fiduciary responsibility for the grant. But in terms of reporting, so the grant will be reported on through the leadership team, through the lead applicant. But it should be mentioned that the co-lead applicants and the lead applicant form a leadership team, and they each have equal responsibilities to the undertaking of the research and the grant. The pre-application also includes co-applicants. You can include up to 10 co-applicants, and then at full application stage, you can include up to 10 collaborators. And this is the applicant consortium. So this consortium will support 3 postdoctoral fellows for 3 years. And I suppose the salient point here is that the consortium are the people who are funded, they receive the funding, and the HRB fellows are then recruited through an open public process, and they are supported through the grant. So the consortium is made up of the leadership team, which can be the lead applicant and either 1 or 2 co-applicants, co-lead applicants, up to 10 co-applicants and collaborators. And together, this consortium of individuals needs to cover the necessary breadth and depth of the research and the expertise required for the programme of research that is submitted. They need to have appropriate interdisciplinary and cross-sectoral representation. There should be international collaborations in there, and there needs to be a strong public and patient and other relevant stakeholder involvement. So PPI is very important. I'm going to talk a little bit about the different components of the leadership team and the consortium and what the differences may be, or what the differences are. So the leadership team, which is the lead applicant and the co-lead applicants, should be an experienced research established team of 2 or 3 individuals which hold equal leadership of the programme. These individuals should bring a strong track record in applied health and social care research, and they should have demonstrated their contribution to knowledge in accelerating the transfer and application of research into real-world applications. So they should have experience in transferable research. They should come from a complementarity of disciplines and skills and expertise, and it should be this complementarity and these skills should really be relevant to the research program that's submitted. They should bring a clear strategic vision for the research program. They should bring a strong collaborative and networking expertise and a strong track record in training, supervising and mentoring early career and mid-career researchers, because this is a career development call. Excuse me. So co-applicants then, they can be researchers, they can be knowledge users, they should be data controllers or processors, and they can also be PPI contributors. A co-applicant has a really well-defined and critical role in the conduct of the proposed research. They can be from outside the island of Ireland. And this is welcome, but it does have to be properly justified. Because they may receive funding through the grant for items such as running costs and PPI costs. Co-applicants don't receive support towards their own salary. So the only people funded through this award is the HRB fellows, the 3 HRB fellows. It's advisable that the terms of any co-application should be determined early in the process. The agreements should cover governance arrangements, intellectual property rights, reporting and access to data and samples, which may be required for the purposes of the co-application and the agreement therein. So collaborators then are slightly different. Collaborators an individual who will have an integral but discrete role in the proposed research. They can include investigators, or they can come from organisations outside of the Republic of Ireland. And they can come from a range of backgrounds, such as academia, private sector, healthcare organisation, from a charity or a patient group. So individuals should really only be named as a collaborator when they are really providing a specific contribution. This is a really important one. So if you have an application and you want to put in as a collaborator somebody who is very big in the field, you want to make sure that that person does have a role on the program. That's something that the reviewers will be looking at, that if somebody with a big name is on it, that they actually are contributing something and they're just not there for the sake of being named. A collaborator can act in an advisory capacity, but this needs to be documented. They can provide training, they can supply samples or kits, they can provide access or specific equipment or staff, they can provide staff placements, access to data or patients, or they can bring industry know-how. So I'm going to talk now a bit about the eligibility for this call, which is really about the leadership team members. So we're looking at the leadership team members in the context of eligibility for CPFP. There are specific criteria that each member needs to fulfill. So for the lead applicant, the lead applicant has to have a role in a HRB approved host institution in the Republic of Ireland, and that institution will be the host institution for the grant. It should be submitted through the host institution of the lead applicant, and they can only be listed as a member of a leadership team on one CPFP application. For co-lead applicants, there's a bit more leniency, so they can either hold a post in an institution as per the lead applicant on the island of Ireland as an independent investigator. They can be somebody who will be recognised by their institution upon funding of the CPFP grant, or they can be a clinician, somebody who's working in a hospital, and somebody who holds a post in a health organisation on the island of Ireland. Or they can be an individual who provides non-academic perspective as a person affected by the research. This can be a professional working on the topic or a representative of an organisation active in the area. Co-lead applicants also can only be listed on one application. They can't be co-lead applicants on more than one application, or lead applicants on more than one. They can only be listed in the leadership team of one application. That's important. If there are people who are listed on two applications, both of those applications will be automatically ineligible. So please do remember that. We have there is specific eligibility for the leadership team that will be looked at a group level. So the leadership team as a group, either 2 or 3 members, must fulfill all of the criteria I'm about to go through, and each criterion must be fulfilled in full by at least one member, but one member does not need to fulfill all criteria. So as a group, the leadership team needs to fulfill the following. One person needs to have a PhD or a PhD equivalent research experience. For more information about PhD equivalent research experience, you can find it on the HRB website. One member of the leadership team needs to have at least 7 years of full-time equivalent research experience by the deadline of the pre-application, which is December 17th. And one member needs to have at least 3 independently peer-reviewed research grants, with at least 2 of these grants each of a value equal to or above 300,000 from a recognised funding agency. And it can be an EU work package as well. One member of the leadership team must have been a primary or principal supervisor of a minimum of 3 postdoctoral researchers in the past for a minimum of 12 months each. That is 3 different postdoctoral researchers for a period of 12 months. One member must bring experience in bringing together and leading interdisciplinary and cross-sector collaborations. That shows evidence of engaging with non-academic stakeholders and involvement with policymakers and practitioners or voluntary and community organisations, as well as PPI. And the last one then is a record of research outputs with at least 3 publications of original research in peer-reviewed journals. For any questions on eligibility, you can contact me if you're unsure that your leadership team meets all of those 6 criteria. So in terms of the funding and duration, the duration of every CPFP grant is the same. Every grant is 42 months. This allows for 6 months for programme setup and recruitment of the postdoctoral fellows. And each fellow, each of the 3 fellows will have a contract at full time for 3 years or 36 months. The funding is 950,000 in direct costs, and this covers the salary of the 3 fellows and the research-related costs for the programme of research. The overhead costs, which are given to the host institution to support the award, are indirect costs. They are not used by the research programme, and they will be calculated at contracting stage and added to the award. So I'm going to talk about the HRB Fellows, because the CPFP is a career development award. So any application that comes in has to be very clear about how they're going to support the fellows that are funded through the grant. There's an expectation that the 3 recruited fellows will be involved in the management of their own research project. Obviously, the application will have been funded, but they should be able to develop or continue to develop the programme of research that they're working on with the support of their supervisory team. They should support the annual reporting on the programme. And it's also expected that a network of HPFP fellows will be in existence so that they can work across grants with each other. Career development is a really important component. So it would be expected that the fellows would continue to develop their careers and become independent applied health and social care researchers. They should have opportunities to develop independent thinking and to manage future grant in their own right. They really need to undertake training and development activities which support their career progression, and should be involved in the establishment of new collaborations and partnerships, or become involved with existing ones. They should receive very strong mentorship on their further research development, not just on the research programme that they are delivering. They should be facilitated to conduct high quality research projects as part of the programme, and they should be actively involved in the patient and public involvement on the programme, as well as other stakeholders. To ensure that this is in fact the case, there is a requirement in the application for a training and development strategy for the postdoctoral fellows. Now, at pre-application stage, this is high level, but at full application stage, it needs to be fleshed out. So it would be expected that the strategy would enable the postdoctoral researchers to work in a team-based environment, to tackle identified problems from a variety of perspectives, but in a collaborative and complementary approach. They should have the opportunity to work in interdisciplinary and transsectoral research. The strategy should be clear that it facilitates the application of research findings into policy and practice. So the postdocs need to be aware and be trained on how their research can be translated to the real world. The strategy should ensure that they are facilitated to progress towards more independent research and future research leadership. The strategy will include, it should include placements for each of the HRB fellows in non-academic settings. It might include intersectoral or international elements aimed at experiential learning, networking and collaborating. These placements don't necessarily need to be relevant to the programme, but it is relevant to the development of the postdoctoral researcher. Should be relevant to the programme, ideally. There is funding within this grant for a travel grant. So each of the PhD fellows should have an opportunity to travel and work with international collaborators, and that needs to be included in the development strategy. And ultimately, all the training and mentoring and all the contextual methodological items need to be covered in this development strategy. They should have plenty of opportunities to develop professional and transferable competencies. So as I say, while the development strategy is high level at pre-application stage, it really needs to be fleshed out at full application stage, and it does come with an assessment criterion for the peer and panel reviewers, and I'll go into that a little bit later. First, I'm going to look at the application and review process. So the CPFP grants are assessed through two-stage application process. At the moment, we're at pre-application stage. So the pre-applications will undergo a panel review in February. And at that time, people who have been reviewed and are invited to full application will go through the full application process. So the full applications are by invitation only. They will go through peer and public reviews. They will have an opportunity for an applicant response, and they will then have an interview panel review. And I'm going to talk a bit more about those after I go through the pre-application assessment criteria. So at pre-application stage, the panel review assessment criteria are as follows. It's the first is the applicant team. Now, I should mention that there are 3 assessment criteria, and each of them are differently weighted based on the information required in the pre-application forms. But for the applicant team, the panel reviewers are looking for the strength of the applicant team and the suitability. And when I say applicant team, I mean leadership team and co-applicants together. They're looking for the appropriate track record in applied health and social care research, their experience in training and development of researchers, the breadth of expertise covered by the applicant team, the skill set that they bring, evidence of collaboration with non-academic stakeholders, and also the strategic vision and leadership that the applicant team bring to the programme. The second assessment criterion then is the collaborative research programme. So the panel members are going to be looking at the relevance and the impact of the programme at this point. They'll be looking for clarity and coherence and relevance of the central research question and the area to be addressed. The use of systematic evidence to justify the research need. The integration of the research activities and the coherence of the programme across the different projects that the postdoctoral researchers will be working on. And they're looking for evidence of a clear pathway to impact and real-world solutions with strong potential for significant impact on policy, practice, or systems at a national or international level. And the final assessment criterion is the training and development strategy. Now, because we only ask for a high-level training and development strategy, this criterion comes with a weighting of 20%, where the other 2 come with a weighting of 40% each. So at this point, there is a high-level training and development strategy requested, and the panel are looking for the coherence and the quality of the training and professional development strategy. And that's what they will be commenting on and discussing. So those applications which are invited to full application stage, having gone through pre-application stage, will be subjected to international peer and public review. So peer reviewers will be focusing on the assessment criteria for the call at full application stage. I'll go through those in a moment. And they will provide comments as well as a score, which is visible to both the HRB and to the panel members. The public reviewers who assess the applications will only assess the quality of the patient and public involvement in the application. And they'll provide comments and a rating, which will be shared with the panel. They don't provide a score. So after the peer review and public review components are complete, the applicants will have an opportunity to respond to those comments. The anonymised peer review and public review comments will be made available to the lead applicant on their GEMS personal page, and the leadership team through the lead applicant will have 10 working days to submit their response through GEMS. There is specific word counts for the applicant response. So there is a 2,000 word count for the response to the peer review comments, and there's a 500 word count maximum for response to the public review comments. And I would suggest it is advisable that when developing an applicant response, that it's really important that you keep it concise and you focus on any issues that have been raised by the peer reviewers. Anything that you need to address in the context of what you would like to tell the panel members in the context of issues raised by the peer reviewers. It's important to use this word count well. So after the applicant response, the panel members will be issued with the peer and public review comments and the applicant response, as well as the full applications. All leadership teams will be invited to attend an interview at the HRB offices. Each application at this point is assigned a lead and a secondary interview panel reviewer. And at the end of the panel meeting, a final score is collectively agreed for each application, and they're then ranked according to score. So what the panel reviewers and the peer reviewers will be looking for are these assessment criteria. So when writing your application, it's important to be cognizant of the assessment criteria that the peer reviewers and the panel members at each stage of the application will be looking for. So for the applicant team, they're looking at full application stage for the complementarity of expertise across the full team. Now, this includes collaborators at this point too. They'll be looking for evidence of meaningful collaboration with knowledge users, PPI contributors, and other non-academic stakeholders. They will be looking for strategic vision and leadership capacity to deliver the programme, including management and oversight. They will be looking for the next criterion then is the collaborative research programme. And I should mention that 3 criteria at this stage are equally weighted. So under the collaborative research programme, they're looking for the quality and coherence of the collaborative research programme within the overarching thematic area and strength of the applied health and social care research. They are looking for the likelihood and potential of the programme to generate high quality and actionable evidence that can directly inform and influence healthcare policy and practice. So the evidence generated needs to be translatable. The training and professional development strategy will be significantly fleshed out at full application stage. So we're looking for the quality, the panel members are looking for the quality and the coherence, and the peer reviewers are looking for the quality and coherence of the training and professional development strategy. They'll also be looking at the quality of the environment in terms of the institutional support, the partnering organisations, the facilities and the infrastructures. Now, I just want to comment on PPI. So all of the panel members will be advised to take PPI approaches into consideration under any of these assessment criteria if they consider it relevant. So after the full application stage, we move to board approval. The recommendations of the interview panel will go to the next board, and once the board has approved the recommendations, the outcomes will be issued to the applicants. At this point, a summary of the panel member comments and the panel discussion is issued to all of the full application applicants, regardless of outcome. So I'm going to talk a little bit about the narrative-based CV for the leadership team. This is something that is new in the context of the leadership team will be assessed at a group level rather than being assessed as individuals. So the reason for this is, as a signatory of the San Francisco Declaration of Research Assessment and a member of the Coalition for Advancing Research Assessment, COARA, the HRB commits to the recognition of diverse outputs, practices and activities, such that they can really maximise the quality and impact of the research. So this requires that the assessment focuses primarily on qualitative judgment, supported by responsible use of quantitative indicators. So the leadership team narrative CV enables the leadership team as a whole to showcase their relevant skills and demonstrate the team's ability to deliver the programme of research that they have submitted. They should include the relevant skills and experience that is specific to the programme of research proposed. They should only describe a selection of their past contributions. These contributions should really be the best evidence of their ability to deliver on the programme of research that they've submitted. It is, even though it's a group, it's assessed as a group, it is appropriate to highlight specific individuals' achievements within the narrative. But the contributions described across each section really should demonstrate the appropriateness of the overall team, of the overall leadership team, to deliver the specific programme of research that has been applied for. So the sections of the narrative-based CV, there are 4 main sections of the narrative-based CV. So the first is contributions to the generation of new ideas and knowledge, and this section focuses on ideas, hypotheses, tools, including how ideas have been communicated, can include key outputs from previous funding awarded to the team. The second then is contributions to the training and development of others and maintenance of effective working relationships. And this really includes supervision and mentoring, as well as any expertise, which it might be critical to the success of other individuals. The third section then is contributions to the wider research and innovation community. And this section can include various activities that the team members have engaged in to contribute to the growth of the research community locally, nationally, or internationally. And the fourth section then is contributions to broader society, which emphasizes societal engagement and knowledge exchange. So I'm going to go into each of these sections in a little more detail in the context of what's required. So contributions to the generation of new ideas and knowledge. In this section, you're first asked for a short statement of the team's overall contribution to the research field or discipline. And this really serves as the abstract, I suppose, for the group CV. And it comes with a word count of 250 words. So it really is just a high level overview of what the leadership team brings. The next section in this section is relevant research outputs. So you have to include 10 research outputs, each briefly described. They should include the specific role of the team member who the output is associated with, the significance and influence of the research to the research field, and the resulting impact. This section has a word count of 800. So you are looking at a word count of 80 per output, where some outputs may require more than others. So it's up to you to use the word count well. So research outputs that are included here, they can include data sets, they can include software, publications, commercial or entrepreneurial or industrial products, educational products, clinical practice developments, policy publications, and other similar items. We're not specifically looking for peer-reviewed publications and funding in this section. You can describe lots of different types of research outputs that are relevant to the research programme. The next section then is contributions to the training and development of others and maintenance of effective working relationships. So here we're looking for supervision, mentoring, line management of people on a research team. We're looking for project management expertise, any involvement in workshops or summer schools, coordination or support of team members, provided to the advancement of colleagues. We're looking for the provision of expert advice, and evidence of that, and use of leadership teams to shape the direction of a team. The next section, contributions to the wider research and innovation community, both locally, nationally, and internationally. We're looking for research review, committee panel memberships, evidence of editing and reviewing, contributions perhaps to the evaluation of research, contributions to increasing research integrity, improving research culture, appointments to positions of responsibility, establishment of collaborations, partnerships, and networks, strategic leadership by directing an organization or company or an institution. And the fourth one then is contributions to broader society. So we might be looking for PPI involvement in research, collaborating with community-based groups or organizations. We're looking for contributions to policy and practice development, working with policymakers and knowledge users, science outreach activities for the general public, contributing to public understanding, engagement with industry and other non-academic stakeholders, and impacts across research policy and practice, and business, and other examples of how the team has ensured research is translated for the good of all. Now, I should mention that these 4 sections are not extensive. So there is a 400 word count for each of these sections. So it's important to keep, which is about a half an A4 page. So it's important to keep these fairly succinct and to the point. So finally, then I'm going to talk about the timeline and the contact information. So the timeline for the CPFP call, the pre-application closes on the 17th of December. The next that the applicants will hear is the invitation to the full application, which is late February. The full application submission is mid-May, and the applicant response is end of August to mid-September in 2026. Panel recommendations will then be presented to the HRB board, and outcomes will be issued in November 2026. So for more information on this call, you can contact me, Anne Costello, at at the dedicated mailbox there. And I will now address any questions. So anything that has not been covered will be included in an FAQ document, which will be available shortly. I'm just going to stop sharing and I'm going to have a look if any of the questions have come in. Okay. So I'm just going to have a quick read through here of some of the questions. Okay, so one of the questions here is just to confirm that there is no budget for pre-application stage. We don't ask for any budget information at that point. The budget will be included in the full application form. There's a question here about how many applications will be invited to full application and how many will be funded. So we will aim to invite between 8 and 10 applications to full application stage, and we will aim to fund 4 of those applications, which will enable 12 postdoctoral researchers to be active in the system. Apologies while I read through some questions here. Okay, so will HRB fellows employed under this scheme be eligible to apply for future HRB funding using this funding call as their eligible project grant? That was indeed one of the benefits of the ARP programme. So this CPFP grant, unfortunately, does not recognise the postdoctoral researchers as the PIs of the grant. So no, they wouldn't be able to use this grant as fulfilment of eligibility criteria for other calls. So there's a question here. The eligibility of the lead and co-lead applicants seems to stipulate researchers in higher education only. Are researchers from other institutions, including HRB host institutions, eligible? So for the lead applicant, for lead applicants and co-lead applicants have different eligibility criteria. The lead applicant does need to be from a HRB recognised host institution, and they need to be employed there. However, the co-lead applicants can come from, they can be clinicians, or they can be PPI contributors, or they can be from patient organisations. So the eligibility for each of the members is a little more flexible for the co-lead applicants, while it's relatively stringent for the lead applicant, who will have primary fiduciary responsibility of the award. However, the leadership team is recognised as having equal responsibility for the research programme. So another question is there a specific pre-application form on the portal, which is different to the full application form? Yes, the pre-application form is currently the only application form which is available on the GEMS portal. The full application form will be available only to those individuals invited to submit a full application. So what people should be doing at the moment is considering whether they are eligible and fulfilling the pre-application form, which is available on GEMS. So one of the questions is, one of the postdocs will the postdocs be allowed to apply for a research fellow salary? Research fellow salary is not supported under CPFP because it is looking to support early career postdocs. So we're looking at postdoc level 1 to 2, depending on the requirements of the program. So one question here is to confirm, is it up to 3 co-leads plus co-applicants? So 13 named co-leads and co-applicants in total, that is correct. So the leadership team can be a maximum of 3 individuals, and then you can have an additional 10 co-applicants at pre-application stage to a total of 13. Another question here is, can a clinician working in the HSE be a lead applicant? They can, if somebody has a joint appointment and is also recognised by a higher institution, academic institution, then yes, they can be a lead applicant. If they are a clinician scientist and they are solely supported by the HSC organisation, they can be a co-lead applicant, but the lead applicant does need to be employed by a HRB recognised host institution. The question here is, will the leadership team be covered for travel expenses? The budget for the CPFP will cover only the budget for the salary and the running costs of the postdoctoral researchers, and that includes their travel to for their travel grant and for placements, but no, it does not include the leadership team for travel expenses. Another question here is, can funding from another source be added to this grant if the programme needs additional funding due to scope? This would need to be really well described in the application, because the programs of research can be part of a larger program of research, and that's outlined in the guidance notes. But it would need to be very specific in the context of what the CPFP grant is funding and what other grant funding is supporting. Okay, so would a leadership team of 3 where 2 have worked together before but not with the third be considered new or existing? It should be, I suppose this question is asking whether an existing consortium or not existing consortium is important, and it is not. You don't need to be from an existing consortium. It will not affect the review process whether you come from a previously existing consortium or not. So if there are 2 members which are existing and they add another, this won't impact how the application is reviewed. It's just that people from existing consortiums can apply, but also new consortiums can also apply. I hope that's clear. There's a question here, would you prefer applications with leadership teams from more HEIs, higher education institutions, or rather all lead applicants from one institution? Where the co-lead applicants and the lead applicants are based will be entirely dictated by the requirements of the research programme. So it would really depend. So the way that the leadership team will be assessed is whether they bring the correct expertise required for the program of research that they have applied for. And that is what should be assessed. They should come from ideally different disciplines, and bring an interdisciplinary approach. But it is not required that they're from different higher education institutions. So there's a question here. So it definitely cannot be funded if our work involves any animal study. No, an animal study would be considered preclinical research, and that is out of the scope of the CPFP call. Okay, so there's another question here. How many years post-PhD does the postdoc have to be? Is there a maximum of years as early career researchers? There is no specific number of years post-PhD that the postdoctoral researchers need to be, and it will really be determined by the research programme and the requirements that the leadership team and the lead applicant team need to fulfill their programme of research. What you should be aware of is that we will support postdoctoral researchers at level 1 or 2, but not research fellows. There's a question here, is it open for foreign nationals? I'm not certain if this is for the leadership team, co-applicant team, collaborators or the HRB fellows. But if it is for the HRB fellows, they would be recruited on the basis of the higher institutions' policies on recruitment. So it would be expected that yes, foreign nationals could be recruited if assuming appropriate visas are in place. But this would be for the higher institutions to negotiate. There's a question here, how many proposals are expected to be funded in total? I think I may have said this already, but we intend to fund 4 proposals, which will support 12 postdocs throughout the system. I think we've gone through many of the questions. Anything that hasn't been addressed at this point, you can either contact me directly, or if it's something that would be useful for everybody, it will be included in an FAQ document, which will be developed very shortly. So I'd like to thank you all for attending the webinar, and we will leave it there. As I say, please do contact me if you have any questions. Thank you very much.